Hey, I'm Sophia with SOS. Did you know that Black women continue to be diagnosed with HIV at disproportionately high rates compared to white and Latino women, according to the Center of Disease Control? Despite recent progress that has seen new HIV diagnoses decrease, Black women continue to account for 6 in 10 new HIV infections among women. SOS Saving Our Sisters from HIV-AIDS is a signature service of Sisters for Sisters, Inc., a nonprofit organization dedicated to providing HIV/AIDS education, awareness, and prevention for women and girls. We are committed to saving our sisters from HIV/AIDS. Our mission is to provide culturally sensitive outreach programs to save and end HIV in our community. For over 10 years, we have hosted more than 70 community outreach projects to address the stigma while providing a safe space to share real talk on sexual health, HIV/AIDS, and sexually transmitted diseases. Please get tested and know your status. Together, we end HIV/AIDS one sister, one community at a time.
Ooh, baby, love safely, take care for you and me. To all my men and my woman out there. Ha. Ooh, HIV is a place where you don't want to be. Take care of yourself and everybody else. You don't want your health to go in the wrong direction. Gotta stay safe, gotta use protection. Take care. Over and over and over again. Remember, your safety is for you, it's for them. Over and over and over again. Remember your heart, your place. Keep it safe. Stay safe. Ooh, baby, love safely. Take care for you and me. To all my men and my woman out there. Ha. Ooh, HIV is a place where you don't want to be. Take care of yourself and everybody else. You don't want your health to go in the wrong direction. Gotta stay safe, gotta use protection. Take care. Over and over and over again. Remember, your safety is for you, it's for them. Over and over and over again. Remember your heart, your place. Keep it safe. Stay safe. Ooh, baby, love safely. Take care for you and me. To all my men and my woman out there. Ha. Ooh, HIV is a place where you don't want to be. Take care of yourself and everybody else. You don't want your health to go in the wrong direction. Gotta stay safe, gotta use protection. Take care. Over and over and over again. Remember, your safety is for you, it's for them. Over and over and over again. Remember your heart, your place. Keep it safe. Stay safe.
I am the lead peer educator and program assistant for the AFIA Center. Right now, I am training HIV-positive people to become peer educators and to disclose their status. I found out I was HIV positive while in a treatment facility for substance abuse. I had made some bad choices in my life that landed me there, and I decided to go ahead and take the HIV test. And back then it was a blood draw and you had to wait 2 weeks. So I waited 2 weeks and came back. They came back and they called me back there. And she said, it doesn't look good. And I said, what doesn't look good? And she said, it doesn't look good, and she walked out. I knew right there and then I was HIV positive.
TPA. The Texas Plus America pageant had they call it a boot camp or a training institute where they teach you how to walk and speak and sit and the whole nine. And I was up bright and early waiting on Michelle to make her entrance.
I thought I was Beyonce when I walked in from her reaction.
I had my book in hand. I was ready for her autograph, and she was just like so gracious, trying to act like she wasn't a celebrity or anything. I tease her about that all the time.
You'll be okay. You're not going to die. I thought I was going to die when I first found out, but you're not going to die. HIV is easily, you can live with it, if you take your medications, if you educate yourself on it, and that there's life outside of HIV. HIV is just a diagnosis. That doesn't mean you have to stop living.
There's a lot of negativity that comes along with it because of the stigma attached to it. But for the most part, you have to be yourself, and you have to know that HIV is what you have and not who you are. Right. It shouldn't determine what you do or where you go or how you see yourself. You have to have a high self-esteem and not allow it to tear you down.
If I can do my part to save someone's life, then this is my duty to do this. Let's stop HIV together. Get the facts, get tested, get involved.
I get tested every year. Get tested annually has always been a part of a routine visit that I would request being tested for HIV. And after a routine pap smear, I tested positive. And about 2 weeks after I was diagnosed positive, I found out that I was pregnant. So I guess dealing with it, I didn't really start dealing with the HIV part until after I had my daughter. During the pregnancy, it was extremely difficult. Taking the medications, I wasn't able to keep it down. I didn't understand if I was getting sick from either the baby, was I getting sick from the medicine, or was it the HIV? Shortly after I had the baby, I began to disclose my status to people. I wanted to make sure that my baby was okay before I started saying anything. If you're HIV positive and you're newly diagnosed and pregnant, it's not going to be easy. Of course, pregnancy comes with a lot of hormones, and sometimes it can come as a challenge mentally, thinking about, am I infecting the baby while I'm pregnant?
That's what best friends do. That's what anyone should do. They should support someone. They shouldn't just make that person feel like they're in it by themselves and nobody care about them, nobody loves them, because they have HIV.
I try to encourage young people to have confidence when they're newly diagnosed, but the only way for them to do that is to be educated. They have to learn, why are you taking this medication? Ask as many questions as you can to your doctor or your physician. If you have a peer educator, ask them questions, and reach out for support. You're still gonna live. You're gonna live if you want to. You're gonna live and take great care of yourself as if you didn't have HIV. The only difference is now you have to look at your health and put it on the forefront. HIV stands for Human Immunodeficiency Virus. So as long as you're human, you're at risk. Yes, you may have HIV, but it doesn't determine who you are in life. There are many people that have that you may never know that have had it for years. So you just have to keep going and keep going forward.
Let's stop HIV together.
Get the facts, get tested, get involved.
Hi there.
CDC TV presents Health Matters.
Well, it seems I have your attention.
Where did you come from?
I'll explain later. I see you're interested in finding out about HIV-AIDS. Well, I'm here to help.
Great, because I have a lot of questions.
And I have a lot of answers. Okay? Here we go.
Okay, so just how widespread is HIV-AIDS?
HIV-AIDS is a global problem, with more than 34 million cases reported worldwide in 2010.
That's huge.
Yes, and in the U.S. alone, over 1 million Americans are infected with HIV, and more than 20% of those don't know it.
What kind of infection is HIV exactly?
HIV, the human immunodeficiency virus, is a virus that kills the human body's cells that help fight off infection and disease. There's no cure, but with proper medical care, people with HIV can live long, healthy lives.
What about AIDS?
HIV causes AIDS, or acquired immune deficiency syndrome. HIV infection destroys the body's immune system, and when it fails, a patient can develop AIDS, become very sick, and die. More than 16,000 Americans with AIDS die each year. The virus can be transmitted to anyone. In the U.S., men who have sex with men account for more than half of all new HIV infections each year. But others are also at risk, especially African Americans.
It appears that many diverse people are at risk. So how do you get infected?
The main ways people are infected are having unprotected sex or sex without a condom with someone who has HIV. The virus can be in blood, semen, or vaginal secretions. It can enter the body through tiny cuts or sores in the skin, the lining of the vagina, penis, rectum, or mouth. Also sharing needles and drug equipment. And babies born to women with HIV also can become infected during pregnancy, birth, or breastfeeding.
Aren't there a lot of myths about how you can get HIV?
You cannot get HIV by being around someone with HIV, or from saliva, sweat, tears, clothes, drinking fountains, phones, or toilet seats, or through everyday things like sharing a meal, insect bites and stings, donating blood, or from a casual closed-mouth kiss.
So, French kissing is risky?
It would be extremely rare that way, and only if there were contact with blood. For example, if the mouth or gums were bleeding.
Good to know. How do I find out if I have HIV or AIDS?
Doctors can offer HIV tests, or you can go to a local public health office or healthcare clinic.
Who needs to get tested?
CDC recommends all Americans ages 13 to 64 get tested at least once to know their HIV status to help prevent spreading the disease. Annual HIV testing is recommended for persons with ongoing risk for HIV, such as injection drug users or people with multiple sex partners. Recent data suggests that high-risk men who have sex with men should be tested more frequently. And pregnant women should get tested to lower the chance of giving HIV to their baby, before, during, and after birth.
Why is testing so important if there's no cure?
Because there is treatment. If you find out that you have HIV, you can get early medical care. It can help to slow the disease, support your immune system, help you live a longer, healthier life, and you could prevent giving the virus to others.
What can you expect from an HIV test?
A healthcare professional takes a blood, urine, or oral sample, and sometimes you may even be able to wait for your confidential results. So if you want to find out more, you can visit hivtest.org to find a testing site near you.
This is great information, but I have a big question. How can you protect yourself?
Abstinence, or not having sex, is the surest way to protect yourself. But if you do have sex, make sure it's only with a partner who's not having sex with others, has been tested, and you know for sure is not infected. Also, consistent and correct use of a condom every time a person has sex can prevent transmission. And never sharing needles or drug equipment will also protect you.
Infection from HIV sounds totally preventable.
If everyone gets the facts and gets tested, it would be a good start to preventing the spread of HIV. So ask your doctor for an HIV test. It's the only way to know for sure.
Thanks. I'll take that advice.
Great. Well, it's time for me to go.
Hey, where you going?
Back to work.
Cool. But before you leave, I have to ask you again, where did you come from?
Oh, that's quite simple. I'm with the CDC.
HIV is a virus that attacks a person's immune system. Most people get HIV through anal or vaginal sex or by sharing needles and other drug injection equipment with a person who has HIV. HIV can also be passed by a pregnant woman to her baby during pregnancy, childbirth, or later through breastfeeding. Without treatment, HIV can make a person very sick or even cause death. The only way to know if you have HIV is to get tested. Knowing your status can help you make healthy decisions. To prevent getting HIV, take medicine called PrEP if you're at high risk. Always use condoms or clean needles, never share needles, or choose not to have sex or inject drugs. If you have HIV, get in care and take HIV medicine as prescribed. With the right medical care, you can live a long, healthy life and prevent transmission to others. For more information on HIV, visit cdc.gov/HIV.